Hello, everyone. Welcome to the Arts and Mom podcast. I'm Lauren Rose, and today's guest is Sherry McIntosh. She's an APRN, which is an advanced practice nurse practitioner with 7 years in pain management. She's now relieving pain with functional medicine, which is exciting. And I like talking to people who do functional medicine and alternative kind of modality. So I'm excited to talk to you today. Welcome.
Thank you. I appreciate it.
So let's start by you just telling us about your own chronic pain that you've dealt with, what you dealt with, how long you had it, how it affected your life, things like that.
So back in my 50s, I was an RN, not an APRN, and I was working in a hospital in ICU. And so that meant working nights that I had to turn patients quite a bit. Man, that was painful. And for those that do night jobs, they know that you don't get much sleep during the day. So because you work nights and you're not getting much sleep, you gain weight. So I gained
Mhm.
probably 60 pounds my first year on nights. And then all of that went to my back and my hips. And it felt like I was in a vice every day, being pressed against the vice in my back and in my hips. And I could not get relief. And so, then because you're overweight and you can't sleep, you sleep even less. And so
Mhm.
I had two kids at home and I was dealing with all that pain and I couldn't get rid of it. And I went to the doctor and the doctor said, "Oh, well, let's give you these pills." So they gave me opioids. That slowed my stool down. So then I got constipated. And so then that just added another problem. So then he said, "Well, let's try physical therapy." So I went to the physical therapist. And while he was moving me, it felt good. But after I went home, oh boy, I was in a lot more pain. So then I had to find something else that would work. And they said, "Oh, maybe need to see a psychiatrist to help you deal with your pain." So then they put me on an antidepressant, which made things a whole lot worse. And I just got tired of the runaround. And so then I found a functional medicine practitioner that helped me deal with my weight gain, my slow gut, my slow gut healing, my pain in my back, and then that put me on the road to try to find out what I could do myself to start making myself better. And then I went back to school and I got my nurse practitioner license and I started looking at photobiomodulation. And that is using a class 4 laser to help with pain and with fibromyalgia pain, with back pain, with peripheral neuropathy. And so that just put me on the road to where I am now, seeing patients dealing with pain through functional medicine and through photobiomodulation.
How long were you dealing with the chronic pain yourself before you started getting relief?
8 years.
Oh, wow.
8 years. So I worked nights, and I still had kids at home, and I mean, it was excruciating, and every day was just worse and worse and worse and worse.
How did your
We
pain
had
affect? No, go ahead.
Well, we had a wood stove. So not only was I dealing with pain, then I had to, do heavy lifting too on top of that. So I was heavy lifting at work, heavy lifting at home, and I never could get my back or my hips to the point where they weren't having pain. So that was worse. Yeah.
So, how did your physical pain affect your ability to parent? Did you have to modify things? Did you have to say no to things?
Yes, because we lived in the country and the kids, for fun, they wanted to go swimming and they wanted to go for walks and they wanted to go kite flying and they went into town and get on the monkey bars at the park. And I was not able to do those things because my back was killing me. Walking was oh so painful. And flying a kite, oh no, there's no way I could run. And so my husband had to take over a lot of those responsibilities and he got to the point where hey, girl, I thought we were in this marriage together. I don't understand why you can't. And I mean, because he was fit and fine and he didn't have any of these troubles. And so, yeah, it made a strain on my relationship with him, a strain on my relationship with my children. And it just made me just feel awful. I thought adulthood would give me freedom, but it trapped me. It trapped me in this
Mm.
painful body that I couldn't get rid of.
Yeah, and I totally get that, and I know a lot of other people do, because it's bad enough when you have chronic pain, but then when you're trying to raise little ones, I mean, I've had chronic pain my whole life, well, not my whole life, but my daughter's whole life, and it started out with migraines, and then it developed into arthritis and fibromyalgia and degenerative disc disease, and so ever since she's been 3, though, is when I really had to stop running around and jumping around and being really active with her. And so she doesn't really remember me as a mom who could do that kind of stuff with her as a baby and a toddler. And that makes me really sad that has always she's always going to remember me as having chronic pain and not being able to do those kinds of things and having to tell her, I can't play anymore because, my hips are hurting to do this or my back is hurting to do this. And it just makes me really sad that that's what she's going to remember.
Yeah, but now I'm a grandmother, so I have grandchildren. And recently we took them to Hot Springs, which is a sort of a town where people go have fun, and there's a lot of things that kids can do. There's a Magic Springs is a park, and you can go and ride rides and do things in a water park and things like that. I'm out there with them doing that stuff, and they say, "Grandma, you're so much easier to get to do things with than mom, and she doesn't get out here and you do." I was like, now I'm having so much fun as a grandmother. I can't tell you how important it is to get control of your body, control of your pain, and control of your life. I feel like I have been set free because it was bad before and now it's way so much better.
That's absolutely amazing. I'm so excited that you
Yes,
can do that.
yes, yes.
So speaking of just pain in general, can you explain kind of where pain starts?
Pain starts in the brain. Um, so if you stub your toe, you have a sensory nerve that goes from your toe all the way up your back to your brain. And your brain realizes that that's something hurting in your toe, and it sends back a reaction through a muscle to your toe to make you draw it back. So you're not hurting yourself, continually hurting yourself. The pain medicine opioids blocks that pain signal up to a point in your brain. So it's like you have a cone, and here is the cone on top, and the medicine covers that cone. It covers the pain signal because that's where the pain signal comes from. It comes up through the cone to the cone. And then the pain medicine blocks that pain signal, but it only does it for a short period of time. So at some point, that starts to break down and the cone is uncovered, and then the pain comes back. But it doesn't come back the same it was before. It comes back with a vengeance. It's worse. So pain medicine is not something that I use in functional medicine. I don't use opioids at all. There is a new thought, and that has been proven. And I can send you the sites to tell you about how it works. But basically, it is cannabinoids have a different um, pathway to get to the brain to block the pain signal. And CBD is a new thing that's a byproduct of THC, and it has been shown to block that pain signal in a different way. It works from the sensory nerve and the muscular nerve along that pathway to the brain to block that pain signal. So it goes up and then it doesn't go all the way to the brain, it comes back down. And so it also decreases inflammation in the place where the pain began. So if you have back pain, you have inflammation in your back because it's hurting. And so it tells your body, rush fluids, rush everything to that place to get it better. And then it swells. It's just like a cut on your hand. You know, it swells and it gets red. Your back and your muscles and your nerves do the same thing inside. So you need something to help block that pain signal. So then we're working on your mitochondria in your cells. We're working on your gut to get anti-inflammatories into your body. We're working on the outside of you with the photobiomodulation to get light to the area of your pain, and that rushes water and blood to it to help heal it. It heals it from the mitochondria out. So you have pain relief, and then you have anti-inflammatories in your system to help get you back on the road to getting better, so that God has made a wonderful thing in our bodies. He has made it so they can heal themselves. Your bodies can heal itself if we give it the right tools. That's my job. I give it the right tools, and God starts healing it from the inside out.
Yeah, my next question was going to be about just kind of what is functional medicine, but it sounds like you've given several examples. And so is functional medicine exactly what you just said, just giving your body the tools that it needs to heal?
That's the simplest way that I can describe it. Inflammation in your body begins in your gut. It begins in your stomach where you eat. Inflammation can come from many things. Most of the time, it's what we put in our bodies. It's the environmental things that we take in. It's the preservatives in the cans. It's the pesticides that we put on the vegetables and the fruits. It's the BPA, the plastics that coats all insides of all the plastics. That gets into your DNA, and your DNA says, hey, stop. Don't put anything like that in me anymore. I can't function. So that sends a message to your gut to put out all this cytokines to fight it, and then things start going downhill. One of the ways that it works is all those bad things that are in your environment you're putting in your mouth goes to where? Your fat, and stays in your fat, and it just recirculates in your fat. So if you're a little overweight and you're eating the wrong things, you're just going to continue to gain fat because your body wants to get rid of it. It wants to take that thing that you're put in it that it doesn't want to have, and it wants to throw it away, seal it away somewhere so it won't be used. Your liver really doesn't want it, so it puts it in your fat. Then it just keeps recirculating all the time, recirculating in your blood, and your DNA gets worse and worse and worse. So we got to heal from the inside out, and that's what functional medicine does. It changes your diet, it changes your exercise, it changes your mindset, it changes your spiritual thoughts. Then it changes the water you drink, the things you take in, and then we give you supplements, nutraceuticals to start healing the places in your body that were sick. And then it takes about 3 months to get better, but I promise you it's worth the journey. It was worth it to me. um, I just found myself going to doctors and them saying, I can't find anything wrong. But I knew inside myself there was something wrong that I need to fix. And so that's what made me seek functional medicine as a patient first, and now as a practitioner.
Yeah, I have never in my almost 100 podcasts heard somebody say that their pain management doctor or their neurologist or their rheumatologist fixed their chronic pain for them. Never, not once. It's all been through natural modalities, mind body things like functional medicine, these alternative approaches every single time. And a lot of people haven't healed, but I mean, I've talked to a lot of people who have, and it was all through those kinds of things. And I think that's just completely fascinating and a testament to how little the typical medical community knows about chronic pain, and how to manage it and how to heal it. They just don't really understand chronic pain. So they give you pills and they tell you to go to physical therapy. And then when you do all those things and it's not helping, they say, well, I have no idea because your x-rays are fine or your blood work is fine, your MRIs are fine, and they just don't know what to do. So they just keep giving you different pills and more pills.
Yes. And unfortunately, some of the pills they give you can cause side effects that make your problems worse. Um,
Mhm.
it, some of the ladies over 42 were given medicine for their diabetes that affects their brain and causes early Alzheimer's. So I say stay away from pharmaceuticals if you possibly can and go to a functional medicine practitioner who's just going to give you natural products and help you get to a natural diet so you're not putting things in your body that can make you ill.
So this, I hope I say it right. I wrote it down so I would say it right. This photobiomodulation device that you have, like how common of a device is that? If we have a handful of functional medicine practitioners in our area, like what are the chances that they might have one of those?
I would say slim and none. It's usually
Okay.
done by chiropractors. Chiropractors are the basic of professionals that I've seen buy one. Occasionally, you'll have a physical therapist that has one, but they've been shown to help with wounds. So I don't see it being used in wound clinics at all. And and we have some people that had spider bites that were causing necrosis, and it healed that spider bite on their foot, and in like 3 weeks. And so that hardly ever happens. What I've seen in my practice with pain is I had a lady who had COPD, and she had peripheral neuropathy from her knees down for 2 years, and she had numbness, and she was falling all the time. Falling will cause you to break bones and cause things to be worse. And so I started working with her. In 2 weeks, she had feeling back in her feet and her legs. So now I just uh, cataloged all of that so that next month when she goes to see the neurologist, he's going to say, "What did you do?" And she'll say, "I did photobiomodulation." And she helped me with my diet. So now I'm eating things that I need to, and now I have feeling back in my feet. So thank you, doctor. I don't need you anymore.
Yeah, that's
That's
going to be a good feeling.
yeah.
So if we really need to focus on our gut and the things that we're putting into us both nutritionally and environmentally, like how do we know if we have a healthy gut and what can we do to, just in general for our gut health?
So, if you have bloating, if you have pain after eating, if you have reflux, if you have constipation, if you have IBS, all of those things are signs that your gut is not healthy. So you need to do something about that, and going to a functional medicine practitioner will help. You can Google all you want. Let me tell you, some of my patients tell me, "I'm so glad I found you because I am so sick of Google. I go to one thing and I'll do one thing, but it doesn't take all the problems away. And then I'll go to another thing and I'll do that, and that doesn't work either. So I need somebody to direct what I need to do." And that seems to help more than anything. It's this head them in the right direction, get them some supplements that's going to help them to start feeling better within weeks. And then after that, you just, guide them to what to eat and how to exercise without hurting yourself, because that's a big thing. People, "I'm overweight, well, I need to really go at it." No, you don't, because all of that stuff that I'm trying to do to heal your gut is taking all those things that's stored in your fat, putting back into your circulation, and you getting rid of them so you don't feel good. So I just warn them, this is what we're going to do. This is how long it's going to take, and then help them get better.
It's an interesting thought. You mentioned those symptoms, and I'm thinking about my daughter. She's 11, and she's already got acid reflux and some gut problems that kind of come and go. And so I hadn't thought about taking her to a functional medicine doctor. We've taken her to the GI doctor, and they've done all sorts of samples and tests, and everything's great, except her symptoms are still there. So it's like, give her an antacid. And I'm like, why should I have to give my 11-year-old child an antacid pill from the pharmacy? I mean, she's 11. Like, I don't understand why she even has this at such a young age, and they don't have any answers. And it's just
No.
frustrating.
But we have pediatric functional medicine practitioners. And since you live in the Dallas Fort Worth area, I know there's quite a few of them down there. And they will help you and your daughter to get to the place where she doesn't need those medicines anymore. Because I know in my case, those medicines made my bones weak. So I developed
Mhm.
osteopenia from having them. And I know that that's not good to start giving them to a child that's 11, because then what she's going to be when she gets to be a teenager or a young adult? What is her bones going to look like then? So we don't recommend that at all as
Yeah,
functional medicine.
doesn't seem like a great idea to give an 11-year-old antacids that are, I don't know, it just doesn't seem like a great. I just feel like, and it's just frustrating because I feel like they should keep doing more things or ask questions or send you to somebody else. It's just like, oh, we don't know, come back in 6 months and tell us how she's doing.
Yeah. Yep, that's unfortunately that's the way it works and with conventional medicine, and that's why I still do a little bit of conventional medicine because I work for a pain management physician, but I'm slowly getting him to the point where he realizes that functional medicine really works, and it helps the patients to get better faster without pain, without opioids that are so dangerous.
And if we can
Yeah.
get our bodies to heal themselves through these different dietary changes and, helping our gut and all these other things you're talking about, then we don't need to continue seeing these practitioners, whether they're, regular doctors or whether they're functional medicine practitioners.
No, you don't, because my my job, and that's crazy, isn't it? I teach people how to not come back to me.
Yeah.
That's what I teach them, and that's crazy. But then not only do I teach them, but I teach them how to take care of their families. And I see sometimes I see mothers that have pain, and then I'll see their husbands who have high blood pressure, and I treat
Mm.
that. And then I teach him how to not come back and see me. And then he tells his dad, and his dad comes to see me, and I teach him not how to not come back and see me. And that's crazy, isn't it? There's no conventional medicine that says, doctor that says, I'm teaching you how to not come back to me. But that's what I do. And that's why I like it, because I think I think we should at this. I mean, do you remember when your grandmother was little? She would tell you stories about how she never went to the doctor. There were all these things that she did at home to take care of herself. We need to get back to that, don't we? I mean, wouldn't that be
Yeah.
nice?
Yeah, that'd be amazing. And I mean, but then, the pharmaceutical industry wouldn't be making so much money and the doctors wouldn't be making so much money. And heaven forbid that all happens.
Oh, wow, yeah.
So tell us about your practice and where we can find more about you and what you do.
So my practice is named McIntosh Health. I had to think about that one for a long time, right?
Mm.
And so it is in Fairfield Bay, Arkansas, and I have a website, www.macintoshhealth.com, and you can go there and find me, and it's got my phone number and how I can help you. I can also help you online. I don't have to help you in person, but I would really recommend that if I help you in online, that you find some practitioner in your area if you're having pain that can help you with photobiomodulation, because that really does help your pain, and it gets you to the point where all these other things can work together, and then you don't need to come back anymore. Fibromyalgia is so sad because it affects the brain in different ways, and if you don't get all these things right, then you're going to keep going to doctors for years and taking medicine for years that you don't need. And so I want you to get to a point where you don't have to do that anymore. And the laser, class 4 laser will help you get there. And so I would recommend that if you find somebody, then you go to do that.
Yeah, I think that's awesome. And I love the fact that, you think your job is to basically help people. So, instead of just giving them pills and telling them to come back in a few months. So I think that's beautiful.
Yeah, that's exactly what I do. It's crazy, isn't it?
In this day and age, it kind of is, but I like it.
I like it too. Yeah. So I have a lot of kind of different kind of patients here. I don't just have patients who have pain, have them with hypertension. I have one lady who, this is a sad story. She's a teacher and she was in a school for 16 years that had mold problems. It had water leaking in the rooms, and then it was built in 1978, so there was an old paint on the walls that was peeling, and then she had asbestos hanging from the ceiling, so she was exposed to lead, cadmium, asbestos, and mold, those four things. And she had to be cleansed from those. She had gained 60 pounds. She lost her hair from here back. She lost all of her hair. And now her hair is beginning to come back with little small hairs, like your eyebrow hair. And it's just sad. It's sad that she had to go through the cleansing because of where she worked. I say, she needs to go back to that place and say, this place needs to be shut down. But, as a teacher, she's sort of not going to do that because she's afraid that she might be sued or, for saying things. And
Mm.
she hasn't been tested. But a lot of people are exposed to mold. Did you know that if you buy those protein bars in the grocery store, that the FDA has allowed them to have 3 to 5% mold in them? You know why that
No,
is? The reason why that is because the corn and the wheat that goes into those, after they're collected from the field, they're put into silos. Those silos are pretty tall and pretty big around. And what happens when all of that wheat is in the bottom of it? It's got warm, it's moist, it has mold. So heaven help you if Nabisco happens to get the uh, batch of corn or wheat that's from the bottom of the silo before more is in there, and you're going to get more mold. So after they make it all the batches up, then they spread it out over many batches, and you get the 3 to 5% mold. But guess what? If you're exposed to a lot of mold and you have mold in your air conditioner at home, and then you are eating that, you're going to get sick. So people think sometimes in the South, oh, it's the South that's making my nose run. No. Could it be the mold that you're exposed to all the time? And the BPA that's coating all the plastic bottles and all the plastic cups that you have, that's full of BPA. And that goes straight into your DNA and causes your DNA to have abnormal SNPs on your DNA. That goes to your gut and your brain and tells it, we got to get something better here. This is not working for us. So you just have to be real careful about flame retardant furniture. That's, you breathe that in. That goes into your lungs. Could the COPD be caused by that? I don't know. All I know is if you are exposed to those kind of things, you need to get them out of your life because those are the things that make you ill. So if I've found that in just a few of the patients that I've seen, how many patients in the Dallas-Fort Worth area have that same problem? A lot of them.
yeah, that makes perfect sense. I didn't know that it was so rampant. And I don't really think about environmental factors very often, except maybe when it comes to like cleaning chemicals or something like that. But I mean, you brought up a lot of other things that have got me thinking that I just don't know what's even around me.
Yeah, it's better to test that out. So as functional medicine practitioners, we don't guess. We use lab tests to tell us what's going on inside you. So if we do a stool test, we do 2 days of stool test and we look at everything. We see every single bacteria that you have in your gut that you've had for a while. And if we do a urine test, we look at everything. If we do a urine for heavy metals and toxicities, I can guarantee you that over 50% of the people in the United States have heavy metals and toxicities in their urine that need to be cleansed, but they don't know it because the tests are never done. What happens is you get the patients who are really ill. They've been ill for a long time and nobody can find out what's wrong with them. They come to you as a last resort. So when you start doing those tests on them, you realize, wow, every single person that I see has these problems. So that could be one of the reasons why we have so many ill folks that can't get well.
That makes sense because these environmental factors, a lot of them aren't going away unless we intentionally get them out of our lives by knowing better.
That's right. In France, you can't get get gluten wheat that has gluten in it because they won't allow those seeds to be over there. So in France, when you go to buy your bread, you buy it for one day. You only buy enough bread that you're going to eat in one day because the next day that bread is done. It's moldy. They got to get rid of it. In the United States in 1982, we allowed Monsanto to change the wheat in America, and farmers can only buy seeds from Monsanto nowadays. They've all been modified. So GMO, you hadn't heard about that, but for the last 10 years. But since 1980s, that's what's been in our wheat and in our corn. So we need to start looking at that. So I only buy wheat and corn from farmers that I trust, and vegetables and meats from farmers that are organic, so that I know everything I eat, everything I put in my body, everything I do is totally good for me. I'm not hurting myself in any way by eating or doing these things. And so everybody needs to sort of start thinking about that. That's why the organics have gone wild in America, because Monsanto hurt us in 1982 and it's still going on and nobody's doing anything about it. In Europe, that don't happen because they don't allow that. So shouldn't we just sort of take a hint from that? Try to do something about it? I would think so.
Yeah, I have a lot of listeners that are in the UK, so I don't know what they do in the UK, but if it's you're talking about Europe, it's probably a lot different than what we do here in the US.
Yes, much different.
Yeah,
Yeah.
we should definitely, when we learn things, I think we need to change our behaviors. And a lot of times we don't. We just learn things and say, oh, that's interesting, and then push it to the side and keep doing what we're doing because it's easier or because it makes somebody more money or whatever the case is.
Yeah. Insurance is so, I get so frustrated with insurance because it's getting harder and harder and harder for people to make it. Um, Insurance is another way that Americans have been hurt, because insurance won't pay for certain medicines. So if you're on insurance at your work and you get cancer, some of those cancer medicines they won't pay for. And so what do you do then? You have to beg from your friends and family to get money to pay for the medicines you need to survive. And insurance does not pay for wellness at all. And it doesn't pay for photobiomodulation at all.
Mm.
And I also help ask patients to, in addition, to get a red light therapy and start using red light therapy because that helps as well to help heal them quicker. And insurance doesn't pay for that at all. So I think we're getting closer and closer to that because some of the big companies here in Arkansas, one of the functional medicine practitioners is teaching all the Walmart employees how to get better. And so You walk into Walmart nowadays and you see people who are overweight, have high blood pressure, and well, the functional medicine in Arkansas is teaching them, y'all got to get that under control. Y'all got to stop that because you're just teaching your children to be overweight by what you're feeding them. And then that gets Walmart on board to have more organic vegetables, more organic meats, and it starts changing the outlook of things. And so I'm just so happy to be here in this place at this time to see the changes happen and to know that somehow I have a little part in explaining that to my patients so they'll know what to do to start getting better. And I just think eventually we'll get to the point where insurance will start paying for functional medicine, but at this point it just don't happen.
I really hope that they do, because I've seen a functional medicine doctor and had to pay out of pocket, and I'd love to see one again. I'd love to send my daughter to one, but I mean, financially, that's really, if we could even do it, would really strap us. So it's just not fair that insurance won't pay for things that have science behind it, but just won't make the doctors and the big pharma money.
Yeah, that's it in a nutshell. I sort of think the way that big pharma and physicians have controlled things is they go to the legislatures of their state and they get things changed at the local level, and then it sort of filters up to Washington, and then eventually they get on board. And I think as functional medicine practitioners, I'm in a group here and we gather together twice a year and we start talking about ways that we can go do that to make some changes here in our state. And that's what I would recommend if you're a functional medicine practitioner and you live in your area, that you start working with your legislature, because I promise you that's going to be the way change will happen. And it'll happen quicker that way than to go to each individual company and start making those changes. So there's many ways that we can make those changes, but it's just going to take work from all of us. And I'm willing to put in the work as long as God leads me here. I'll do what I need to do to start getting those things to help my patients, because it's not fair to them. It's not fair to the lady that's 85 years old who's living in a chair to the bathroom, chair to the kitchen because she's having so much pain. And insurance doesn't do anything to help her except give her those opioids that slow down her, make her constipated. And I just don't think that's fair. So we should do whatever we can, because one day I'll be that 85-year-old woman and I don't want to be sitting in the chair. I want to be up doing things with my grandkids.
Yeah. You've given us a lot of information. I hope people look into functional medicine and find some, practitioners who do the photobiomodulation or the red light therapy or just functional medicine in general, because I think it can be so helpful. Thank you very much for coming on.
Appreciate you.
Mm. All right, make sure to subscribe to this podcast so you don't miss any health, parenting, or life advice. For my freebie 30 ways to relieve pain without taking a pill, go to ithurtstomom.com/tips. If you have comments, suggestions, or want to be on this podcast, email me at ithurtstomom@gmail.com. I wish everybody a blessed and pain-free day.